Hello and welcome to today's. Today we are going to revise one of the past papers, the NCK past paper. This was done in 2007. This is paper 1. So welcome to the session. Let's go to question 1. So the sequence in which impulses are transmitted in a simple reflex are, so we have option A up to D. I'll give you a minute to attempt. Correct. So we have option B as our correct answer. And what is the justification behind that? You find like for the option number one, the option number one is wrong because the reflex arc ought to begin with the sensory receptor and it must end with motor responses and not the other way around. You can be able to see option C, it's wrong, it's incorrect because motor fibers should come after the connector neuron, while option D is equally wrong and incorrect because sensory information is received first, not motor, not motor input, right? Okay, so that's how that question ought to have been approached. Let's go to question number 2. Question number 2 says management of retinal detachment includes a minute. Ladies and gentlemen, as you know that irinodectomy and trabeculoplasty is an incorrect option because these procedures are typically for glaucoma and not retinal detachment. We have the number C, which is administration of carbonic anhydrase inhibitor and cryopexy. This is equally incorrect because carbonic anhydrase are normally used for glaucoma, right, and not retinal detachment. We also have the epinephrine administration and trabeculoplasty, which is also equally incorrect. And as you know, epinephrine is not the standard for retinal detachment, and the trabeculoplasty we have already mentioned is for the glaucoma, right? So our correct answer should be option B. A positive Shevstock sign is elicited by, we have NAS A up to NAS D, which NAS is giving us the best option. You have a minute. All right, guys. So when NAS A says that occluding blood flow to the arm for 3 minutes, inducing carpal pedal spasms, this describes the Trocher sign and not Shevstock sign, right? Yes. NASB says administering high calcium supplement, including inducing hyperglycemic crisis, is incorrect as this will cause hypercalcemia and not hypocalcemia, and does not describe how Shevstock sign is elicited. NASD says a sharp tap on the leg below the patella bone, inducing jerky movement of the lower leg. This describes patellar reflex that is commonly elicited or assessed when somebody is on magnesium sulfate, okay, and not Shevstock sign, right? So the correct NAS here should be NAS C, who says a tap of a facial nerve just in front of the parotid gland, causing the mouth, nose, and eye to twitch. Number 4, the management of umbilical hernia includes, we have nurse A up to nurse D. You have a minute. So nurse A says wearing a truss, herniorrhaphy, and hernioplasty, right? Nurse B says wearing a truss, eating small frequent meals, weight reduction. Nurse C says herniorrhaphy, hernioplasty, eating small frequent meals. Nurse D says wearing a loose dress, hernioplasty, and wearing a truss. Wearing a truss, eating small frequent meals, and weight reduction is incorrect. As you know, dietary changes and weight reduction do not treat hernia itself. Herniorrhaphy is a surgical repair. It's needed for definitive management. Herniorrhaphy, hernioplasty, and eating small frequent meals. That is option C. This one is incorrect, as dietary, we have already said, is not directed towards hernia treatment, right? Wearing a loose dress, that's option as D. Hernioplasty and wearing a truss is incorrect, as loose dress has no clinical relevance in hernia management, right? We have wearing a truss, eating small frequent meals, and weight reduction are also incorrect, right? So that's why, because of the because of the diet changes, weight reduction, this one they don't treat, right? They don't treat. So in this case, we expect you to have picked option A. Number 5, clinical manifestations of cancer of the bladder include, we have nurse A up to nurse D. You have a minute. So nurse A says polyuria, frequency of micturition, and painless hematuria. Of course, polyuria is excessive urination, and this is not typical associated with blood cancer. So that makes that option wrong. We have nurse B who says proteinuria, frequency of micturition, and polyuria. Now proteinuria, so this is excessive protein in urine, and polyuria, so the two are not classic symptoms of bladder cancer. Option C, nurse C, we have dysuria, oliguria, and proteinuria. Oliguria, this is reduced urine output, and proteinuria, and so proteinuria and oliguria are not standard symptoms. Dysuria may occur, but painless hematuria is usually the key, the key sign here for cancer of the bladder. So that makes option D, nurse D. That's frequency of micturition, dysuria, and painless hematuria to be the best option here. Number 6, factors considered when choosing the site to create a colostomy are, so we have nurse A to D, you have a minute. So nurse D says age of the patient, local skin infections, and previous scar. Now, age alone is not a critical factor, and while maybe the scars and infection could matter, the affected part of the GI is more important. You have to know that. Narcisse talks about patient's preference, blood supply to the area, and surgeon's preference. So the patient's preference is important, but not a deciding factor over anatomical and other clinical and clinical needs. Nurse B says surgeon's preference, sex of the patient, local skin infections. Surgeon's preference and patient sex are not the primary consideration. So we could maybe look at the skin folds, previous scar, part of the GIT affected, because anatomical and clinical consideration take precedence over the rest. Number 7. So for question number 7, you need to indicate whether the following statements are true or false by simply indicating the correct answer. So F for false, T for true. We have otosclerosis, a conductive hearing disorder. Cerumen impaction is managed by irrigation, softening, and then antibiotics. You have a minute for that. So if you look at cerumen impaction, we know cerumen impaction, in cerumen impaction, antibiotics are unnecessary unless there is an infection, right? And so that makes this statement to be false. However, we have to agree that otosclerosis is a conductive hearing disorder because it affects the middle ear, right? Guys, a link will be popping up on the ear disorders. You can look at the different disorders of the external, middle, and inner ear. When turning a patient who is in a hip spica cast, what happens? We have nurse A up to nurse D. You have a minute. Nurse S says the patient is moved in a steady, even pulling motion to the side of the bed. This is incorrect as the movement needs careful coordination, not just simply pulling the patient, right? Nurse says the patient's trunk is moved first, then the lower limbs, and this is equally incorrect. You need the entire body to be moved as a unit to avoid stressing the cast. Nurse D says one nurse pulls the patient while the other one pushes the opposite side. This is incorrect as this could create strain and even uneven movement, causing discomfort and damage to the cast. So maybe the nurse that is giving us a better option could be B, who talks about pillows being placed below the buttocks to support the cast. Gout mostly affects the following joints, all right? So we have nurse A, nurse D, give us the affected joints in gout. If you look at option A, you find that the pelvic joints are rarely affected by gout. So that makes that option to be wrong. We have option number 2, nurse 2. It's incorrect as the first metatarsal is more commonly affected than the last, right? So that last makes it wrong. Nurse D talks about the hip. You know, it's incorrect as the hip and shoulders, these one are rarely affected by gout, right? So gout majorly affects the first two metatarsal torso joints, ankle, elbow, and the elbow. So that makes option C to be more appropriate. Fibromyomas are, have nurse A, nurse D, you have a minute. Fibromyomas are NAS A says NAS A is incorrect. As you know, fibroids are more common uh, in black women, right? So that makes that option to be wrong. NAS B is also incorrect. As you know, fibroids usually develop in women after puberty. This is typically within their 30s or 40s. NAS D is equally incorrect. This is incorrect. You know, fibroids can arise from any of the uterine layers, not just the submucosal layer, right? So that makes option C to be more appropriate. It's non-tender on palpation. Remember, these are benign, right? Benign tumors. Guys, a link will be popping up on the differences between malignant and benign tumors in the body. The indications for hemodialysis include NAS A to NAS D. You have a minute. All right, starting with NAS D. Uh, you know that hypotension is not an indication, right? Hypertension is the reason for dialysis and not the other way around, and that makes option D to be wrong, right? If you go to option C, right? Hypokalemia is not an indication, but hyperkalemia is, right? That makes that option to be wrong. Option B, hypotension again and hypokalemia. These are not typical indication. Okay, hemodialysis is usually indicated for hyperkalemia and not hypokalemia. So that makes option A the most appropriate. Hyperkalemia, drug toxicity, fluid overload, and hypertension. Right, next. Phantom pain is managed by, we have NAS A to D. We have a minute. If you go by NAS A, you know, sedatives are not a standard treatment for phantom pain, right? And if you look at option C, diversional therapy and narcotic analgesics, right? Diversional therapy is useful, but narcotics are not preferred for long-term management because of the addiction, right? So that makes it wrong. Option D, application of heat changing the patient's position. Heat and reposition are not effective for managing phantom pain, right? So that makes the most appropriate answer to be transcutaneous electrical nerve stimulation, right? And partly and diversional therapy, right? Okay, so this is what makes this one wrong here. The primary nursing intervention for a patient with dry heat burns of the face, neck, and chest include, all right, we have NAS A to D. Have a minute. So if you look at NAS A, you know, while infection prevention is important, air management normally takes precedence in burns involving the face, the neck, and chest. And that makes that option wrong, right? Option B, NAS B, preventing contractions and monitoring electrolytes. These are usually secondary interventions, so airway management should be the primary concern. We have option C, establishing a patent airway, administering analgesics. You know, a patent airway that is necessary, that's more urgent. Administering analgesics is important, but not urgent. right? I think if you look at these options, you'll agree with me that option D should be the best, right? Establishing a patent airway and preventing the development of any infection. Option for number 14, infection by the herpes simplex is primarily occurs. Herpes simplex. We have option A up to D. You have 1 minute. All right, option A, NAS S talks about along the affected nerve pathways, lips and mouth, right? And this is incorrect, okay, because herpes simplex does not typically affect nerve pathways like the herpes zoster. They are different. Option B, that's B on the soles, feet, genitalia is incorrect. Herpes zoster, herpes simplex, I mean, does not commonly affect the soles of the feet. So the soles of the feet makes that option to be wrong. NAS D talks about along the peripheral sensory in the thorax between toes and genitalia. This is incorrect because this one is describing the shingles, that is herpes zoster, and not herpes simplex, the one that is in question. So we have to agree that the correct answer here should be on the lips, mouth, and genitalia. The classification of sexually transmitted infections include, you have option A up to D. I have a minute. All right, if you look at urethral discharges, vaginal discharges, lower abdominal pain, ophthalmia neotorium, and lymphogranuloma venerum, okay, the LGV. In this option, you find ophthalmia neotorium has been classified as an STI in adults, and this makes it incorrect, right? What about the next one? Urethral discharges. We have vaginal discharges, genital ulcer disease. We also have low abdominal and non-specific urethritis. That's option C. This one is correct, as non-specific urethritis is an important classification, right? All right. So we have to agree that here this one should not be there. So you had B and D, right? Urethral vaginal discharges, urethral discharges, low abdominal pain, right? Genital ulcer, venereum, and arthritis, right? Okay. So the primary management of tension pneumothorax includes, you have option A to D, right? You have a minute. So administering of 10 liters of oxygen semifolus position is incorrect, as the emergency requires immediate thoracocentesis, not just oxygen, right? Insertion of a large bore into the pleural space, big mask administration of oxygen, right? So when you insert the large bore needle, that is correct. But oxygen administration via the mask, that becomes secondary. Supine position, so on, if you see, supine position is inappropriate because we need immediate thoracocentesis, right? So the option that tells us such is option number B, right? Number B, immediate thoracocentesis. That is the treatment for that case. The immediate clinical manifestation of pulmonary embolism is, have option A to D. Okay, you have 1 minute for that. Nas A talks about migraine headache. Headache is not associated with pulmonary embolism. Nas B talks about hypertension. Hypertension, pulmonary embolism often causes hypo and not hyper. Option C, NAS talks about central cyanosis. Cyanosis can occur, but sudden chest pain is more immediate and more characteristic of pulmonary embolism, and that makes option D the correct one. Bell's palsy is caused by, you have option A up to D, Bell's palsy. Option A, we have herpes zoster infection, spinal cord injury, and tuberculosis, meningitis. Bell's palsy is linked to herpes simplex, not herpes zoster. So that makes that option wrong. We need herpes simplex there. Autoimmune diseases, spinal cord, bacterial of the respiratory tract, right? Spinal cord injuries and respiratory infection are not causes of Bell's palsy. Option D, we have head injury, tuberculosis, meningitis, respiratory tract infection by streptococcal pneumoniae. None of this is related to Bell's palsy, right? So the correct answer is option C, vascular ischemia, herpes simplex infection, and autoimmune infection, right? Option C. We have number 19, where is renal failure in extensive burns is due to, you have option A up to D. Option 1 says that talks about excessive leakage of plasma. You know, leakage of plasma occurs, but renal failure is more specifically due to the kidney's tubules' inability to deal with waste, not the leakage. What about inadequate fluid intake by the patient, right? Saying that these are contributing factors but not direct causes of renal failure. While electrolytes loss occurs but is not the primary mechanism of renal failure, right? So the option C, where kidney tubules inability to deal with waste from hemolyzed erythrocytes and damaged tissue, hypertension becomes the most appropriate option. The immediate care for a patient suffering from epistaxis include keeping the patient quiet, A up to D, right? So if you start with option D, just patient lying and pinching the nose for 2 minutes, this is incorrect as the duration is too short and lying down is normally discouraged. You should be seated, right? Leaning forward, this option is incorrect because cold compresses are recommended and not heat, okay? The heat will dilate the blood vessels more, so there will be more bleeding. Option B, that is lying, all right, but this is incorrect. Sitting position is what we have said is more effective, right? So that is option A being the best one here. Now this takes us to this short answer question where number one was to define uterine prolapse and state five measures that can be taken to prevent uterine prolapse. Uterine prolapse occurs when muscles and ligaments supporting a woman's uterus are weakened, and this allows the uterus to descend into or outside the vaginal canal. These conditions commonly result from birth, childbirth, aging, and weakening of the pelvic floor. We have some of the preventive measures where you could perform pelvic floor exercise, the one that we refer to as the Kegel exercise, maintain healthy diet, avoid heavy lifting, treat and manage chronic cough and constipation, and postnatal care. Number two, state six functions of the liver. We have several functions. Could have metabolism of the nutrients, detoxification, production of bile, synthesis of proteins, storage of glycoproteins and vitamins, regulation of blood clotting, immune system support, cholesterol synthesis and regulation. Number three, draw and label a diagram to illustrate the thyroid gland and its related structures. Ladies and gentlemen, this is what you are supposed to draw, right? The diagram should show the thyroid gland's lobes, right? The isthmus, all right? And the surrounding structures like the trachea, larynx, parathyroid gland, blood vessels that are associated with this organ. Number four, Mr. Mumbo is admitted to the surgical ward in unconscious state. A diagnosis of internal bleeding is made. Formulate two actual and potential nursing diagnoses. For the actual nursing diagnosis, we could have infective tissue perfusion related to internal bleeding as evidenced by consciousness and sign of hypovolemia. This could be low blood pressure, pallor, cold, so on and so forth. Or decreased level of consciousness related to hypoxia secondary to blood loss. For the potential or the risk nursing diagnosis, we have risk for shock related to continued internal bleeding, risk for infection related to invasive procedure and compromise immune response. Step 3, side effects of the following drugs. We have pethidine and nevirapine, right? Of course, nevirapine, this one is antiviral drug used to treat HIV infection. The side effects include, we have rash, including Steven Johnson syndrome, and this one happens, you have to discontinue the drug if there is a severe rash develops, and provides antihistamines or corticosteroids if necessary. Hepatotoxicity, that is liver damage, so you have to monitor liver function tests. If signs of liver toxicity such as jaundice, fatigue are present, you consider stopping the drug and starting a hepatoprotective agent. Flu and the flu-like symptoms, you do supportive treatment with antipyretics such as paracetamol, hydration with close monitoring of any worsening symptoms. Pethidine, this one is a narcotic analgesic that is used normally for moderate to severe pain. Side effects include respiratory depression. In this case, you need to administer oxygen, monitor respiratory status. In severe cases, you can use an opioid antagonist, that is the naloxone, to reverse respiratory depression. Another side effect is nausea and vomiting. So what do you do this here? You administer antiemetic agents such as metoclopramide, placid, or ondansetron just to reduce the nausea. Dizziness and confusion, you have to keep the patient in a safe environment to prevent falls. Also encourage slow movements, assess mental status regularly, and adjust dose accordingly. State 5 major causes of pleuropsy. Okay, Pleurisy, of course, it refers to the inflammation of the pleura, which are the membranes surrounding the lungs and lining the chest cavity. This inflammation can cause sharp pain that normally worsens with breathing or coughing. So we have the viral infections. These are the most common cause of pleurisy, which can inflame the pleura. Apart from the viral, now we have also the bacterial infections like pneumonia, tuberculosis, fungal infections like the histoplasmosis, the coccidiomycosis, especially in immunocompromised individuals, pulmonary embolism, autoimmune diseases, okay, especially rheumatoid arthritis, lupus erythematosus, chest trauma, lung cancer, pneumothorax, heart conditions, gastrointestinal medications, such as amiodarone and procadarone. These are antiarrhythmic agents, all contribute to that. State 6 healthy messages you'll share with a diabetic patient to prevent development of a diabetic foots. All right, you need to practice daily food care. Check your feet daily. Wash your feet every day with lukewarm water and mild soap. Dry them thoroughly, especially between the toes. This will help prevent fungal infections. Moisturize regularly, okay. Trim the nails carefully. Wear proper footwear, right? Control your blood sugar. Avoid or quit smoking, okay. Regularly check footwear. Seek professional help, right? And manage your weight and regular food examinations. Step 3, clinical features of iron deficiency anemia. Alright. Fatigue, power, shortness of breath, dizziness. Those are some of the signs of anemia. Tachycardia, cold feet, headache, brittle nails. We also have inflammation of the tongue, pica, restless leg syndrome, angular cheilitis, cognitive and behavioral changes, heart murmurs, exertional chest pain. All these are some of the signs and symptoms of anemia. Ladies and gentlemen, we've come to the end of the presentation. Remember, paper 1 topics will always be here for us. Adult nursing, pediatric nursing, critical care and theater nursing, professionalism and trends in nursing, communication and counseling, introduction to reproductive health, pregnancy, labor and puerperium, contraceptive technology, gynecological nursing, and STI and HIV AIDS. All right. Okay, guys, thank you and keep revising. I'll be sharing more past papers. You can always go through them to be ready for the NCK exam. See you.